All right, now we're going to talk about the muscles of the trunk, and I got a little special because I got to have Dobby here helping me out to try to make it so we can understand it better. So the trunk, we talked about the axial versus the appendicular skeleton before, and the trunk muscles are sort of the ones in the midline of the trunk, which is the spinal cord, the rib cage, and then the sacrum down below, as well as the head. But we already talked about the head muscle, the facial muscles. Well, let's start with the things that move, the muscles that move the head and the neck around. The first big one, when we look from the back, that we see up front, is the trapezius. And the trapezius is this trapeze-shaped, well, it's a triangle if you look on one side here, but if you take it to both sides, it's a trapeze-shaped figure of a muscle that's overlaying everybody else. And look at there, it starts. The O means origin, and the I means insertion. The A stands for action. So the origin is the place where the muscle starts. So that's the anchoring place. It's not the place that moves it. So this one starts, and that can change because it depends on what stabilized can move things around. But anyway, let's go for it. The origin of the trapezius is from up here in the head, in the EOP, down the neck, down the spine, the midline of the spine and the neck. And what we have there is the nuchal ligament. You see that nuchal ligament right there? And you see this picture up here. The nuchal ligament is sort of like when you look at the spinal in the neck, has a forward curve. And the ligament reaches from that spinous process backwards and creates sort of a attachment site for different muscles. So it goes a little bit back. And so that's the nuchal ligament. So that's basically, we can sort of consider them the extension of spinous processes in the neck, in the cervical spine. And then it reaches all the way down the thoracic spine to the last thoracic vertebra. So that goes to the spinous process, SP, spinous process of T12. So it's the whole thoracic spine. So it's really far down. It's a big muscle. And then it goes down and reaches into the shoulder, and that's the acromion. And remember when we talked about the scapula, the acromion is the outer tip of the shoulder. So if you touch your shoulder, you're really touching the acromion at the outermost tip. And so it's part of the scapula. Also goes on the spine of the scapula. So that's down here, that attachment here. And then it reaches to the front. And the picture here, you could see that here how it reaches around, goes to the front. That's the collarbone, the clavicle right here. So it reaches to the lateral third of the clavicle. So now let's figure out what happens when we contract that muscle. So you just contract that muscle. Unfortunately, you can't tell the brain to contract the trapezius. It's not going to do it. You kind of just sort of visualize it at first and then sort of do that action. And what you can do, though, is you can resist the action that we'll describe, and then the muscle will come together and you can feel it very often. So it helps extend the head. So if you extend your head, if you bring your head back, you will contract that muscle. So if you resist that extension with a hand, and with the other hand you feel right by the base of your skull, you can actually feel that muscle bulge out. That's the trapezius. It also tilts the head to the same side. So when you contract it here, these upper fibers will tilt that head down. Does that make sense? Mm-hmm. Good. You have a question?
What's the EOP?
Oh, excellent. The EOP is the external occipital protuberance. That's the big bump in the back of the head that you can feel. Some have it more pronounced than others, but that's an attachment side. So that's actually the attachment side for that muscle, but that's how strong that muscle is. It pulls that bone out a little bit that you can feel it. It then also rotates the head to the opposite side. So that's interesting. So when you actually you contract here, you can see how that brings the head to this side, but it also turns it to the other side. All right, so you can maybe visualize that a little bit. If this is contracting on this side, it's going to rotate it to the other side. So that's what meant that opposite side. And then the other thing it does when the head is stiff, then it has a lot of the scapular motions that happen here. So it helps the shoulder move the shoulder around. And we'll talk about that when we get to the upper extremities. All right, this picture down here, I tried to get a picture on every muscle that shows us trigger point patterns. And trigger point patterns are muscle tension fibers that are connected or corresponding with pain areas. And so when you see here the red stuff, that's pain that this muscle can elicit. So you can actually get a headache from this muscle, or even a jaw ache, or you can mimic a jaw ache. The redder it is, the more people have that be the problem. So you could have some people that have the pain all around here, like this horn-looking thing, or you have most people just feel it in the front. Or then, of course, you also have pain in the back, where the attachment side is. That's kind of that's a fairly logical, or where the muscle runs. And these are trigger points. And so what we can do, these X's here are actually the trigger points, and then these red things are the pain patterns. So we can squeeze, with muscle techniques, we can squeeze or massage these fibers out in here and get rid of these. Actually, what we do is we squeeze them like a sponge, and we get rid of the toxic level in there, the toxic stuff in there, and then new block can come in and they reset, and then we can stretch it a little bit. And so for the people of you that are sort of a little massage-like and like that stuff, I put a picture on every muscle, and you can find these X's, and you can see if somebody has pain. You can say, hey, maybe, well, you maybe got to ask first if that's okay, but you can help them potentially. So that's what I did with that. So that's that goofy picture thing. All right, see here, you got it too. It's a very big one. The next one we're going to talk about is the Sternocleidomastoid. Now that's a big muscle. That's a big name for a muscle. But it's actually an interesting thing, because when you look at muscles, the first one was the trapezius. That was named by shape, right? The trapezius. Now the sternocleidomastoid is named by its attachment sites. So by seeing the name, you actually know the attachments. It's the sternum here. The clavicle is clavicle, and then the mastoid process as an insertion point. So you can figure out that muscle on yourself. When you look what it does, it extends the head, tilts to the same side. So when you actually oppose that, all right, so I figured it out. Yes, it does extend the head, and it tilts it to the same side, and it rotates to the opposite side. So what I can do to feel that muscle stick out here on myself is I can hold myself in this part of the head and try to push into the hand, and then feel it bulging out on this side, and I can grab it with the other hand. So that's how you can feel it. Where does it come from? Where does it go? So it attaches here in the sternum, right here. That's the breastbone, the sternum. It has an attachment side on the clavicle, and then it reaches up into the mastoid process. And you can see it here. This is a very nice picture here. That's a very nice picture, actually. And you can see it here sticking out. So you can see it on somebody. So you can start noticing that on people. We can have it be cramping, like in this picture, and that's known as torticollis. And so that makes it very hard to turn the head. So it's kind of stuck on one side, the head. So that's something that happens once in a while. We have a stiff wry neck. All right, let's go to the scalenes. The scalenes are behind the sternocleidomastoid. So you're reaching now a little bit from that. You're reaching behind it, and you push behind on the outside, and right there you're pushing in some muscle tissue that's a little bit harder to differentiate what is what. And also, you could potentially make yourself hurt a little bit, because you could squeeze a nerve that comes out here. So these muscles are very, very important because of the nerves that come out of here. You can see that right here. The nerves come out of here. And these are the nerves that go into the arm. And if there is a problem in here with these muscles and these nerves get tweaked a little hard, you can have symptoms going down to your arm. And so you can actually see, when you see the trigger point pattern, it goes all the way down to the arm for these muscles right here. So they are attached on the transverse processes of the neck, and then they reach into the ribs. So they go from TPC3 to C7, and they go into the ribs 1 and 2. They bring the ribs up, they elevate the ribs 1 and 2, but they also flex the neck if they use bilaterally. So they bring it forward, the neck, or they bend the neck to the same side if they used unilaterally. And unilaterally means using it on one side. They're only used on one side. All right. The scalene muscles are very important. They're very important. They can mimic the arm pain. And then the other muscle now that comes up here is a deep, deep front muscle, the front of the spine muscle. That's the muscle that's right on the spine. That muscle actually gets really hurt when we have motions that really slam the head back and forward, like front and back. So for example, in a car accident, you're sitting in a car, holding the steering wheel, and somebody slams you from the back. And that first reaction, what happens is the car gets pushed forward. Your head is like a bowling ball. It stays still in space and it slams back into the headrest. And that slamming back really tweaks those muscles here in the front, right in here, that are right on the spine. If you can you visualize that?
Could it happen with whiplash?
That's whiplash. And so what I advise my patients and what I try to do myself is when I'm driving, I try to have my head against the headrest, because if then somebody hits me because they're stupidly texting or something, and it's maybe not that fast, it's not like it's a bump, but it's not like it's gonna slam it back and overstretch these muscles because there's no room for the head to go. Does that make sense? Mm-hmm. And so that's something that's an interesting thing that I tried to do. So let's look at them. We have three parts to those longest colli muscles. We have a vertical part that's most medial. That's this thing going up and down here in the midline. And then we have a superior oblique part here and an inferior oblique part here. The vertical part, the medial part, goes from the anterior bodies of C5 to T3, so down here, C5 to T3 down here, and reaches up to the bodies of C2 to C3, or C2 to C4. The oblique or superior oblique part goes from the anterior transverse process, now not the bodies, the transverse process on the side, of C3 to C5, and goes up to the transverse process of C1. Actually, the anterior tubercle of C1. And then the lower inferior oblique goes from the anterior TP down below here, the anterior body of T1 to T3. Sorry, I got to correct it. Make sure it's anterior body, not anterior TP. And reaches up to the anterior TP now of C5 and C6. So it's causing like this triangle kind of thing. So it's kind of an interesting muscle. It's very, very deep. And what it does in action, it flexes the neck, and it tilts and rotates the neck to the same side. So it pulls the neck to the same side when it contracts. You can see that. These contract here, these contract here. All right. This picture down in here shows us how we can work that muscle, and bringing the chin to the chest activates those muscle fibers. So that's a very good thing to do. All right, let's go to the next one. Does that make sense?